Hi, I'm Tony Gedge and I'm here today with Deepak from Confidental. So, how are you doing, Deepak?
I'm very well, thank you, Tony.
So, Deepak, if somebody's going to come in to see you for sedation, which is the topic of our conversation today, they need to be able to trust you. And I work with dentists from all over the world, and a lot of dentists are reluctant to show who they are. And if we don't know who a person is, it's very difficult to trust that person. So reveal yourself to us, Deepak. Open yourself up. Who are you?
Hi, my name is Deepak and I am a calm and caring dentist. I've been married for 3 years. I have a little baby girl called Naina, who keeps me entertained most evenings and weekends. I love my job. I don't think of it as a job. I think of it as helping people, and that's what I love doing day to day. Sedation, I've been doing sedation for 5-6 years now. And I thoroughly enjoy it. It's an opportunity for me to get some nervous people and convince them that they don't need to be nervous. They don't need to be scared of us.
Okay, so that's again, let's really open ourselves up. So we know what you are. You are a sedation dentist. But we really need to know who you are. If you're going to be spending time, or when you spend time with a patient that's anxious, nervous, whatever their situation is, they're going to be spending time with you, so they need to be able to trust you. So tell us what you do outside of dentistry that we probably won't know about.
Outside dentistry, I love watching Formula One. It's a big passion of mine. I've followed it for about 20 years now, 15 years now. So definitely one way to spend my weekend. I love traveling and hiking. I've done quite a bit of trekking around the world. The highlights of which were Kilimanjaro in Tanzania and climbing to 6,000 meters there, and Machu Picchu in South America. That was 4,200 meters, I think. And this summer we're also doing the Three Peaks Challenge in Wales as well, which is it's another one for the list. So that's what I really enjoy doing.
Wow, incredible. So a little bit, so you're active, you obviously get things done. And what about your wife? Where did you meet your wife? What does your wife do for a living?
My wife works for Lloyds Bank. She wouldn't want to consider herself a banker. She works in the social housing department to help companies or housing charities develop for social needs, so for low-cost housing. And so that's a great sector to work in, and very charitable because it helps disadvantaged people. So it's really good. We met 4 years ago. It was an introduction through a friend, and one thing led to another. What can I say? It's just one of those things in life.
Great stuff. And before we jump into the nuts and bolts of sedation, tell us about your parents. How did they, or your grandparents? What's your culture?
So originally we're from India. My grandfather and my dad came over back in 1972, I believe. So my dad was just a teenager when he arrived in the country. So then I'm the first generation in this country, born and bred here. We're Hindu by religion, but we're not strictly practicing. I like to consider that it's just, I'm quite modern in terms of the fact that I think every religion has its purpose, and I'm quite fluid in that manner.
Excellent. So we've managed to pull some behind the curtain information about you, which is, and there's a load more. I know there's a load more about you as well, but we might get to that. So first point is that when you go see a sedation dentist, you must be able to trust them. And the only way you're going to trust somebody is for them to open up. And unfortunately, because of regulation and bureaucracy within dentistry and the fear with dentists, their own regulatory bodies, it often stops a dentist from, really showing who they are because of this so-called professional boundary. So thank you for opening up to us, Deepak. So why do people avoid the dentist, and why is somebody watching this video now?
In my opinion, it comes down to one of two factors. Either it's a case where someone's had a bad experience, mainly down to trust, which develops fear, or it's fear of the unknown. But once I can isolate what that problem is, there's always an easy way around it. The problem is the patient doesn't see it, that side of it. So once I can gain the trust of a patient, then I can help you, whether you've got needle phobia and I can use a different technique to get rid of that pain completely and not use a needle, or whether it's a case of you having a gag reflex, which the sedative drug works great for, or it could be the case of you don't like things in your mouth, and we can do things in a modern way or a clever way, which avoids us being in your space and giving you that space and confidence in us.
Now, if somebody hasn't been in for 10, 20 years, but for some fear, for example, how does this affect them at work, at home, and socially?
I think those type of people just don't want to smile. They lose self-esteem, confidence. It affects their personal life, their social life, their love life, and it doesn't have to be that way. And the longer you leave it for, the worse it gets, because your mind always plays tricks on you, making you think that it's impossible to treat, or no one can help me. But there are always simple solutions, and simple solutions that can work wonderful to restore your confidence, to get rid of your fear, and that's what we're here to help you with.
So tell us why you personally wanted to help people remove the fear from dentistry with sedation.
Sedation is an opportunity for us to let us rebuild your confidence, and I love that challenge. I love convincing people there's no need to be scared of me. I'm not the enemy here. I can help you get back to the smile that you want and deserve without having to cause you pain or discomfort. And the sedation is a great way of coaching and convincing you and training you to believe in yourself.
Now, you've already hinted here that you've climbed Kilimanjaro, you've climbed, high peaks, so you're interested in challenges. So I think if I were coming to you and you couldn't help me overcome my challenge of the fear of dentistry, I think you'd be severely disappointed, because you love conquering challenges.
One of my own personal fears was trekking and climbing and tall distances, and I convinced myself that I can do it, and just by going out and taking the plunge and going there, and I managed to do it, and I love it now. It's completely different for me. And likewise, when patients have come to see me with a fear of dentistry or teeth or having teeth taken out, and I've been able to convince them likewise that there is no need for that fear. And sedation is a perfect avenue for us to deliver that message.
So just cast your mind back. Tell us a story of the first time you helped somebody through fear, or your first sedation case, or a sedation case that really stands out to you.
One of the first sedation cases I did was actually as an undergraduate. I remember it very clearly. It was a 6'6", 200-pound, heavily built gentleman, bouncer, who was petrified of having one wobbly tooth taken out. And it just went to show that it doesn't matter how big you think you are in life, some of those small things can really make a huge difference in your life. And as a student at that time, it was coaching him to sit down in the chair, to have the sedative drug, and the relief on his face afterwards that he knew he could do it was profound, amazing. So that was the biggest disparity, the fact that this huge guy was so scared of having one tiny tooth taken out, and that we could convince him that he could do it, and he did it. And that was just an amazing result.
So the question is, Deepak, does pain-free dentistry really exist?
It does. We've done a survey, I think it was a couple of years ago, from our patients. I think 93% of them said we could offer pain-free treatment, which is pretty high. I think 92% of them said that we saw them on time, and 93% of them were happy with us and would recommend us to their friends and family. So, I mean, that's a great test after you've asked 1,000 people to vet you, to give you confidence that we're doing the right thing. And we do try hard to deliver that. That's one of our promises.
Now, it could be quite, somebody doesn't just wake up one morning and say, right, I'm going to sort my smile out. It takes years of thinking about this and being able to trust somebody. And also some people a lot of people have to wait for the money to get this done. So if somebody has got money waiting to get sedation dentistry or to get a new smile, obviously what comes into the mind is that they potentially could go on a holiday, they could buy a small car, they could have the kitchen refurbished. Why should they trust you and not buy an experience?
Investing in yourself and bringing your confidence up in life is probably the best investment you'll make, better than any material thing you can buy. You're not buying teeth from us, you're buying a smile from us, you're buying confidence from us, and that is going to pay dividends in the future. It's the best investment you'll have in your life. I know myself because I did the same thing for myself and my teeth, having them straightened and whitened a few years ago. My confidence rose. I'm smiling a lot more. I met my wife, so it definitely works.
Fabulous. Okay, so nobody's ever 100% perfect, right? And we don't want to be seen as 100% perfect, yeah? Because people just don't believe you, yeah? So can you tell us a fatal flaw about yourself? Tell us something, to show us that you're not perfect and that you do make mistakes in life. Open yourself up, Deepak.
I'd say that sometimes if it doesn't go 100%, I do kick myself afterwards. And I shouldn't be results-based, but I am. And that's a big flaw, because I shouldn't be so dependent on making sure I get 100% every time. I think that's my biggest flaw. Just trying to do it as best I can and not being satisfied enough. Even though the patient might be. That's hard to live with. And it's a work in progress.
Okay, so thank you for revealing that. So, okay, let's get on to a bit of credibility. So, how many patients have you seen under sedation, and where did you study, and what have you done since?
So I studied at King's. I qualified in 2008. And since then I've done the relevant courses with sedation. So I've got the accreditation for it. And the cases I've done on my belt are over 100 now. So, of which I think apart from 1 or 2 were very successful. So that's a really high success rate for sedation. Some of the reasons why they might not be successful are that it was very difficult to get the cannula in, but that's far and few, or that the patient didn't respond as well as we'd hoped for the sedation. And maybe general anesthetic was the next option for them, but the majority of patients can happily have sedation and have it done successfully.
Okay, so tell us so what happens, let's not talk about anything that might scare somebody, but just an overview. What is sedation? So
sedation is a drug that will help you relax before your treatment. You're still being numbed, you're still having the treatment done, but the difference is that we pass a very small drug through the back of your arm or your hand, and that really calms you down, as if you've had maybe a bottle of wine, without the hangover, which is the great thing about it. And you'll still be awake, you'll still be talking to us, you'll feel very, very relaxed, and you'll feel more inclined to be accepting for treatment. And you'll find that things just move smoothly for both of us. So that's in essence what sedation actually is.
So you've got a proprietary 6-step process, and it's called being aware but don't care. So is that the whole ethos, your philosophy?
Yes, definitely.
Okay, so can we get being aware but don't care, can we get that on the NHS?
From what I understand, no. It's far and few about where the availability of sedation services are. So things have always been cut back and minimized. There are places available, but I don't think it will be to the standard that I'd be happy with. We try to do things in an ideal here and the best that we can do.
Okay, so in terms of, I know that some, in extreme cases, but even then you have to wait a couple of years on waiting lists, and also because it's NHS, there's a time constraint where you just take all the time that you actually need to do that.
Exactly. We book as long as we need, and we take our time with it, and we make sure we get the job done to the best of our ability. So we have no time constraints at all. And waiting list, there isn't a waiting list here. It's a case of you will be seen and you will be helped, and that's what we're here to provide. Now,
let's hear from a former fearful patient. Now, it's not just about having a beautiful smile that we can show off to our friends and hopefully find a new partner or get a job promotion, but it's also about our health. So just tell us, what is the downside, and not a lot of people know this, but what is the downside of not going to the dentist for our whole bodily health?
The mouth is the window to the body, and it tells us exactly what's going on with the rest of you. So in terms of dental health and body health, they go hand in hand. Decay, broken teeth, gum disease, loose teeth, they're all the major diseases that exist out there, and our job is to find them, treat them, and get you healthy again.
Now, not a lot of people know that apparently 70% of the population have got some form of gum disease. And the more severe the gum disease, the more risk and susceptibilities you are to various other diseases. So just quickly tell us what can happen to our heart, our heads and our body if we do have extreme gum disease.
There are a lot of associations with gum disease and diabetes, gum disease and your cardiovascular systems, your heart and your lungs, as well as the rest of your body. So all the studies point that there is definitely links there, varying person to person. And our job is to fix one and hope that you end up resolving another one as well, or helping at least with another one.
Now, the other thing as well, which is interesting to note, is that I was at a Rotary conference in Madrid in November, a few months ago. And there's a Rotary club there that are really helping their local community with stroke. And I think it's 16 million a year have a stroke worldwide, or 8 million. I think it's 8 million a year have a stroke, and I think 6 million die. So there's also a lot of research around having a stroke with gum disease as well.
Yeah, I can believe that. I mean, it's always ongoing research, and they'll always find new things, but you'd be surprised. The more bacteria you have in your mouth, the more chances are that they're going to go into your bloodstream, and the more chances are they're going to end up causing problems elsewhere. And it's only a matter of time in most circumstances.
So another reason why it's important for us to get into the dentist is that 6 a day in the UK, 6 in Europe, 6 a day die of mouth cancer. Just tell us about that, Deepak.
Well, we always do a screen for every patient every time we see them for mouth cancer. But mouth cancer is a bigger problem than the public are aware. And it's very debilitating as well. So the earlier you catch it, the better chances you have, and the better chance you have to have a decent quality of life as well. The telltale signs are easy to find. Every dentist will screen, so I encourage everyone, if it doesn't feel like there's a problem, you should always get yourself checked out routinely, as you would do for your health, as you would do for your eyes. But your mouth, your teeth, your gums, and any particular cancer is always a risk factor, and it's always worthwhile just making that call and getting yourself checked out, if that's the only thing you do.
Okay, so that's the only thing you do as a result of this, then absolutely brilliant.
Yep.
Okay, so let's, we're just about to finish now. So whoever's watching this, are they suitable for being aware but don't care dentistry? What happens, you've got a 6-step process. Just tell us what happens if you can go through each step of when somebody comes in.
So if someone calls and books with us, you'll have one of our care team look after you. So that's the first step. You'll be sent out a welcome pack, giving you information about what we can offer and how it all works. If sedation's particular, then you'll get our sedation leaflet, which will explain how the sedation works, what's involved, the do's and don'ts. So you have a brief. You'll be fully versed before you can see us. The second step is that you might want to see one of our smile advisors. The second step, and she will help coach you or talk to you about what the options are available. There's 2 different types of sedation we offer here, both tablet form and drug form, IV form. So whichever one's going to be more suitable for you, you're more than well happy to discuss with our smile advisor. The third appointment you'll get with me, and I'll be able to address your concerns, listen to you. I'm always a good listener, my wife says, and find out exactly what it is that bugs you, and I'll find a solution for you with or without sedation. The 4th stage is going to be having your treatment done. You can bring your music with you, you can bring a friend and family with you to help coach and support you, and we'll show you that it's easy to have done. The 5th step, we'll do the treatment pain-free, and the 6th step will be to make sure that we follow you up and make sure that you did have a good experience, that you were okay. And 9 times out of 10, most of our patients recommend us.
Perfect. There you go. So if you are feeling guilty about neglecting your dental health, don't, because as you can see, Deepak, he isn't interested in judging you about how long you've left it. That's not why he's here.
So Lynn, tell us a little bit about yourself and why you came to Confidental.
Well, I've had lots and lots of problems with my teeth over the years, and I've had some awful treatments, and I'm absolutely terrified of dentists now. I went to another dentist and had a consultation, but I didn't feel at ease with them at all. They were too clinical, they weren't friendly, and I just left and I never went back again.
Oh, bless you. So what was the sort of options that were given to you here?
Well, really, I didn't have any options. I had to have my 2 teeth out because they were really loose and they weren't going to stay in my gums any longer. So he said the only option was to have them out, which really upset me.
I bet. Now, you had it under sedation, didn't you?
I did.
How did you feel about having it done?
Well, I have had it before, years ago, and I knew the only way to have any treatment again was with sedation, and it's marvellous stuff.
Oh.
You know nothing from the injection in your hand to when you wake up. You forget everything, so there's no pain, and it's just wonderful. I don't know why I was so worried about it, but I was absolutely terrified again for coming.
Oh, bless you. It's probably because of past experience.
Oh, it's been awful, my past experiences. And I came here, and from the moment I came to the first receptionist I met, who dragged me out of the car from the car park to come in and meet Viswal. Is it Viswal?
Vishal.
Vishal. And Eve. It was absolutely wonderful. I had no regrets in coming here. It was, from start to finish, it's been absolutely amazing. You are so nice.
Oh, thank
So
you. Oh, fantastic. Oh, well, we're glad we could help you get what you needed and that we made you feel completely
I've
at
got
ease.
my lovely new teeth.
Oh, fantastic.
So I was offered implants once upon a time years ago as a guinea pig at another surgery, but that meant no sedation, no anything, and I just can't. I'm just such a coward when it comes to dentists. But I saw this one, I just on spec, I looked up Sedation Dentist and I found Confidential,
Oh, fantastic.
and I've got no regrets at all.
Oh, fantastic. That's what we like to
I
hear.
can come in without shaking and screaming. From the first time I came in that car that day, to be dragged in bodily, it was just horrendous. So thank you so much, Confidential.
Oh, you're welcome. And would you recommend us to
Oh
friends and
yes,
family?
I have, yes.
Oh,
You're amazing, amazing. I don't know how people can be so nice.
oh,